Hey, what's up, everyone? Welcome to the Wealthy Dentist Podcast. I'm your host, Ward Powell. And if you're a dentist looking to crack the code on how to grow your practice and dominate in this space, then stick around. You're in the right place. Every week, we're sitting down with some amazing dentists who are doing incredible things in their businesses. We're talking about everything from how they keep their teams loyal and dedicated to how they stay ahead of the game in this crazy, fast-changing industry. You'll hear about hacks like using virtual assistants to free up your time, strategies to make more sales with less effort, and even mind-blowing stories about patents and inventions that are changing the industry as we know it. And it's not just about growing your practice, it's also about finding out what works from a clinical perspective. Whether you're just starting or you're ready to scale to the next level, there's something here for you. So buckle up, hit that subscribe button, and let's dive in. Good afternoon, Dr. Amel Hassan. We're glad to have you here this afternoon. I just want to thank you for joining us. And I'm thinking about your journey and some of the conversations we had prior. I would like to let people know, as you would express, what got you started with the dental industry. And can you tell us a little bit about that?
Yeah, absolutely. So good afternoon and thank you for having me. My name is Amel Hassan. I actually been a dentist twice in my life. So I guess that's how much I love dentistry, that I was, willing to do it 2 times. I graduated as a dentist the first time back home, Sudan, in 2004. And then moved to United States in 2007 to find out that I cannot practice as a dentist because my credentials are not recognized here. So I faced the option of to give up or to do it all over again and go through dental school. But I am someone who likes to work with my hands. That's what brought me to dentistry in the first place. Loving the medical field in general, but I thought being a physician, maybe not as active hands-wise and this and that. So I just decided to dentistry would be the way I wanted to go, especially that you just see how the difference sometimes between before and after when people don't have teeth and then all of a sudden now they have a smile. So I felt like I want to be part of that change.
Absolutely, absolutely. It's so, people really get tapped into that look they have when they're facing the mirror.
Mm-hmm.
And then to like spread that smile is wonderful, especially when you have a great dentist to make that happen. So, did you have any family members involved with dentistry? It sounds like you started this path very, 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 very young, and for you to, leave your home country and then come here to study all over again, as you mentioned. And did you actually have to start all over again, or did they give you any credits? Well, how did that happen as well? So I guess that's two-part question.
So yeah, back home, the way you get into the dental school is right after high school. You don't have to go to college to earn a bachelor before you go to the dental school. So I went to the dental school the first time when I was 18 years old, right after my high school. Finished a 5 years program. And then when I moved here in 2007, that was after I graduated already and did a 1 year residency back home. To come here and find out actually my bachelor of dental surgery from Sudan is not going to, enable me to practice here as a dentist. That will just get me the prerequisite to the dental school here, which is they need a bachelor degree, diploma before you get into the dental school, because dental school here is eight years. So that bachelor functioned as the prerequisite, and then now I have to enter the dental school. In a way, it kind of helps because I did not start the dental school here from year one. We joined as advanced placement. This is all how dentists that they are trained overseas or they have their degrees from overseas, if they want to get licensed here in the United States, they will join the advanced placement program, which means I joined from the third year. So I had to do 3 years. I joined NYU because the program there is 3 years. Some schools have the program for 2 years.
Oh, wow. Okay. So they did give you some credit and you started in your junior year. And
Yes.
That's undergrad though, right?
That is considered undergrad, yes.
Okay. And so then from there you go into actual dental school.
Yes, because dental school, when you graduate here with the DDS, a Doctor of Dental Surgery, that is considered like a postgrad level.
Mm-hmm.
In my country, when you graduate with a bachelor, that is not a postgraduate. So that is the difference, where the difference is coming from, because the total of years here is 8. Back home, the total of years is 5. So they took my 5 years, considering that is, my prerequisite, like my bachelor. And then after that, I entered the dental school in the 3rd year here as an advanced placement, internationally trained dentist. It's a program, and some of the schools here have that. So yeah, that's how I did it.
That's wonderful. So now that you're certified and you are able to practice here in the U.S., could you, if you chose to go back home, could you do that and practice with no problem?
Yeah, absolutely, I can, because the degree I had here did not mess up with my degree and license back home. Maybe just because of some political reasons and things, I wouldn't be able to go back, because if you guys are aware, politically the country is not stable now. But as far as licenses and being a professional back home, this will actually be more credit for me to be able to practice back home.
Oh, yeah. Okay. All right. So then tell me about this, because I know you were talking before we actually started the interview, you kind of talked about MBA. You like business. So tell me about the business part of your business.
Oh, no, the MBH, it was an MBH, it was a Master of Public
MBH.
Health.
Okay.
That wasn't for the business, but the business came because like anyone, when I finished the dental school here in the US, I joined, my first job was an associate dentist. I just joined corporate America, basically, working for someone, and I did that for almost 3 years. In those 3 years, I actually get to learn a lot about how the system works, how things work, and start paying attention to where are my strengths points are, where are my weak points are, where I'm lacking, where I am talented, and all of that. So I learned quite a lot from those 3 years. I learned that dentistry wise or clinical wise, I am a surgery lover. I like extractions. I like surgery. I actually love the blood, and I'm not scared from it. And I'm more kind of surgically oriented in a good way, because, sometimes to fix things, you have to make them bleed. So we take pride in doing that. Blood is not scary all the time. It's needed sometimes to fix things, especially when people have infections and bad teeth and broken teeth. The only way to help them through a state of health is to get those broken teeth out. So to get the teeth out, we have to make them bleed. And that's how they heal. So as I said, blood is needed for a lot of things. It's needed for healing. It's needed for regaining the health back again. So not necessarily always a bad or a scary thing. So I had a passion for that, and that's where I learned I'm really, having a passion for surgeries and focused on that. And then beside that, my business part started going on as well. Because once you are a clinician, you're working on a procedure, you also have to pay attention to other things. You have a schedule to follow. You have patients waiting, so you have to time yourself. And then you learn little by little, time is not only the time you spend with your patient, time is linked to the business, right? As people will say, time is money in so many different ways that you have to be mindful about. And time is also quality, by the way. A lot of people don't see that. Sometimes someone will come and they will pay X amount of dollars to get a tooth extracted, and they think, oh, that's expensive. But then you put them in the chair and the tooth is out in less than few minutes, or 2-3 minutes, the tooth is out. They'll be like, wow, so you guys charge me all of this to get it that quick? I said, you actually be in charge because I'm that quick. So we're saving the time. You don't want me to be in your mouth digging and digging to get the broken root out, right? That's why actually you pay the oral surgeons extra fees, because they're expert. They get things done faster, quicker, and better, right? So it linked to the quality as well. And in the business world, it means a lot about the efficiency of the business and the flow of the business, and then of course the success of that business as an outcome. And of course the patient experience, because we are in the business of people service, right? We are providing services, so we have to be mindful also about our customers' time and respect that as well, because that adds to their experience. So I've been mindful about the time and start learning about that, because what I learned from how people around me are working, that I kind of move fast and I move quick, which was good. So I learned that I have this strength and I have this passion. Maybe I didn't have a lot of knowledge about the business part itself, as far as the details of the business, the payroll, the HR, the this, the that part I was lacking on it, because I was kind of shielded. I was far away from it. So that's where my first job came and kind of brought all of these things to my attention and kind of showed me where my next step is going to be. And that's how, when I made the decision to leave my first job and to go look for what I like, which is more surgically oriented. And now all of my relation with implant dentistry started right there, because I made the decision that I wanted to be an implant dentist at that point. I want to take the teeth out, yes, but then what after I take the teeth? I can't leave my patient with no teeth, so I have to be able to give them something secure. I worked with denture for so long and learned that dentures are not the best, quality of services that I would like to give to my patient. Yes, they are financially more attainable for the patient, but they are the functionality, the functional capacity, and all of that goes tremendously down with a denture. Almost about 70% of that chewing capacity would get lost when a patient is chewing with a denture. Yes, they're only using about between 20 to 30% maximum of their chewing capacity with the denture, because again, it's a piece of plastic plate sitting on the gum. Most of the time we gotta use denture glue and things to make it fit, and once they start chewing, the muscles movement around it just makes the denture move around. So that will limit the type of the diet of food that the patient can eat. It changed the quality of the life, general saying, not to mention that it also affects the general health, because if I can limit you in what you can eat, I will definitely hitting your general health big time here. People start lacking some, nutritional elements. They have some digestive issue because they cannot really chew their food and things like that. So it came to me like, okay, if I want to provide the best to my patient, I need to learn about implants. And I'm, as I said, by nature, I'm somebody mechanical. I like playing with things and implants in my head is like, oh, the screws. So let's see how I can do that. And it sounds cool to me. For somebody who's surgically oriented, implant made a lot of sense to me. And I said, you know what, let me see how I can add this to my skill level. There was 2 ways for me to do it, whether I would decide to go back to school to have that, and or to try to get it outside by credentials. And since I've been working at that time almost 3.5 years, going back to school and becoming a student again after you already get a paycheck, and it's a little bit tough. You can't really make that decision so easy. So I decided to do it outside and just join somewhere where I can do this and I can focus on this. And that's how I actually came up to the move that, okay, I'm gonna have to quit my job and start my implant journey.
So you've been doing implantology for how long now?
I started in 2017.
2017. So you've been
Mhm.
doing it for a little while. Wow, that's great. That's great.
It's about seven years now, or 8 years in
Yeah.
doing implants.
Yeah.
Only implants. That's all what I do since that. Then I never drilled a filling after that. I was not a big fan of fillings anyhow. That was not root canals, or my respect to my colleagues endodontists out there, but that is, I have zero passion for endo. But of course, when there is the need for the endo, I always send the patient, or refer the patient for the endodontist. It's just not for me. I know exactly what I want to do and what I know to do very well. And I also know where I would say, no, this is not for me. Let it go to the other professional that can do it better than me.
That's great. That's great. And staying in your lanes, being comfortable with being there as well is also important. That's great. So, so can you talk a little bit about your business challenges? The challenges you've had from a business standpoint while you've been a practitioner.
Oh, business is full of challenges, right? It's more kind of so there is, if I would categorize things here, in the dental field, when you're talking about business, there is business challenges inside the office at the office level, and there is business challenges outside the office at the level of the economy, the marketing, all those things outside. But inside the office as a practice owner, you're more than a clinician now. You're way more than a clinician, because you're not only worried about the quality of the services and the treatment that you provide to the patient, you are worried about the whole setting. You're responsible of a team now. And one of the things that I learned real quickly is, dentistry, or a successful dental clinic, is not a one-man show. It's not a dentist show. It's a team show. So if you don't have the right team, if you don't know how to build the team, that takes you the team. Now you're dealing with people. Now we are into the people business, right? Which is really tough. Everybody's different. Everybody have a different background, have a different mentality, different behaviors, different this and that. So you have to find a way to build a team, and building the team will involve a lot of uncomfortable conversation and uncomfortable actions that you have to be comfortable being uncomfortable, basically, right? Hiring, firing, having those difficult conversations, um, and learning. It's like raising a child. You raise your team. When they do something wrong, you have to find a way to deliver that message and to communicate that with them. And sometimes, depending on the situation and what's going on, you will find you want to put it in a nice way, bring it to somebody's attention, or you will again have to go through a tough conversation to get that done, or maybe even tougher, to get to the level that you have to cut some team members out. And then you will learn the rest of your team, because even sometimes the people who leave the team are not necessarily bad people, but they are not a fit for that team. You have to look for the bigger picture. Now, when I do an interview for someone, maybe their skill set is good. And in general, I don't hire only for the skills. The skill can always be taught. I'm a mentor also in one other aspect of me, which is me teaching and transfer of knowledge. For me, is part of what the thing that I enjoy to do. So if you are willing to take from me, I am willing to sit down and teach you and mentor you and all of that. But it also have to do sometimes, as I said, with the rest of the team. Are you a harmonious team member here? Or maybe you're good at what you do, but you can't really fit the rest of the group. So I have the majority here. If I have 5, 6 people, they are working in harmony with each other. I don't want you to come and interrupt that harmony in the team. Maybe that's in those cases, I might end up not hiring you, or basically sending you home, if that might be the reason. So there is a lot of things come into play when we talk about team. And I think those things, when I started doing the business all by myself, and being an owner and a dentist and a clinician and all of that together in one person, I start seeing where I can do good and where I am also lacking, because this is a journey, and I'm not as scared or afraid. I'm very comfortable actually sitting and say, hey, I don't know this. because I think that is an opportunity for me to grow. If I am not saying, oh, this is what I know what I know, and I don't know what I don't know. So, and there is no shame in saying I don't know. So when I found out, okay, maybe I'm comfortable with maybe the time management part of it, the calculation of the time in regard to the business, in regard to the quality of the service I provide to my patient, that's good. Okay, kind of okay at the beginning was how to deal with the team, the people, the this, the that. But then I found out I'm doing this out of just naturally my own talent that I have. And for anything to grow and to go to the next level, you can get started with your passion and with your talent, but you can't grow with that alone. You have to always get the professional skills and get what gets you from point A to point B might not be the same set of skills that will take you from point B to point C. So at certain point, I found myself, okay, my talent is my talent. I'm not adding anything more. Maybe I'm just getting better or faster in the things that I'm doing it, but I feel that I'm lacking more leadership skills and things that I need to know about to help me to be better of a leader and more efficient. And that's where at some point I decided to go and get a professional training on leadership. So I and that is one aspect of it. The other aspect, I always wanted to join one of the brand names. Call it what you call it, but it's Harvard is one of the places that I really wanted to link that to my name. It's a big brand name. It's fancy. It's nobody can deny that, right? It have its own attraction. And I'm like, okay, I need these skills. And they were at that time they were providing a leadership program. So I ended up actually applying for a certificate of a leadership, safety, quality, and informatics with Harvard Medical School. And because Harvard is Harvard, I got rejected the first year. So I didn't take it to the heart. So it hit me. I got sad, but it's, you know what? I'm not a quitter. So I decided to reapply again. The second year after that was actually COVID. So when COVID hit, nobody was, our lives just got interrupted. So I didn't apply right away the next year. The first time I applied was in 2019. And when I get rejected in 2020, I did not apply. And then I applied again, actually in 21. And the second time I actually get accepted. So now I am a student and now I am also running the clinic at the same time. But that was quite of a stretch that took me out of my comfort zone, put me in another experience where I have to show up in my best in both in the classroom and at the clinic for my patients as well. It was a full year program. I did it. It was fun, but not really fun, because some days you feel like, why I just did this to myself? I shouldn't have done this at all, right? So I ended up finishing that program, graduated from there, learned a lot through it. Get to meet new people, get to meet people from different areas, learn from their experience, and it opened a whole world of what is leadership is about. It's more just deeper than leading things, and there is different ways of leadership. There is different ways of team building. There is a lot of skills that I learned, and I think those were needed. And without that program, I would have no clue idea about those things. That helped me into be more kind of better managing and leading my team and getting to learn more tactics and skills that helps to grow the business itself and start growing the picture, and even just giving you a different aspect or a different dimension to how you're looking at the business itself and how you're doing things inside the business. So that was nothing in my plan. I never planned to go professionally and learn something. But again, when I felt that there is need for it as part of the business challenges that I met here, then I went for that. As far as business outside the office, outside these walls, is how you create your marketing and how you put your brand out there, how you build your reputation, right? Because bigger part of the business and the marketing when we speak is start actually in the practice as well. Referral from your own patients and the vibe and the environment in the practice itself, because people, you can always bring people to door somehow, somewhere. You do social media marketing, this and that. people can come to your door, but then they might not like things that they see here. So I think the biggest marketing start also in the office itself and how the team is running and the patient experience, because marketing is all about, I think, retaining patient, not only bringing patient to the door. You can have leads and you can bring those leads to the office, and then what? If this is not a hit and run, this is not a one time. It's a continuous care, right? This is a healthcare facility, basically, whether we're focusing in the mouth or in the body. There's no difference, I think, than the same general health that people receive from physicians or hospitals outside. So you have to create that safe environment for people to feel secure to come back here, and even to feel secure to bring their families or refer their friends and neighbors to come see you. And of course, with all the economical changes and challenges, sometimes going outside, inflations, this and that, you also have to be mindful, because I am actually a fee-for-service, which means I do not deal with insurance people. Insurance people are not my friends. I don't like them. And I think nobody likes them. I'm just honest. I can't sugarcoat that. It is what it is. For me, it's like insurance always, when I hear the word insurance, my head just, I'm like, okay, unless I really have to have insurance, I don't want insurance in my life. Even at my house, I mean, once I finish with my mortgage, I'm not paying for insurance. It's done. Because I mean, we live in Florida, that's another thing, but I don't want to deviate from the topic here. The general idea is the type of the services I offer to my patient, and I am a denture, implants, and fixed full arch type of a clinic. I don't do general dentistry at all. I don't clean the teeth. I don't fill the teeth. I don't crown the natural teeth. I crowns on implants. I do everything have to do with implant. That doesn't mean people who have good teeth don't come see me. They come see me because every now and then somebody might lose a tooth here or there. They will come see me. Then I will replace that tooth for them with an implant, or just sometimes simply, if it's a wisdom tooth and they just want it out, we take the wisdom tooth out, and that will be the end of it. We don't have to do an implant or anything in a wisdom tooth area. So I still see people who have teeth and good teeth sometimes. But general saying, when it comes to dentures and when it comes to implants work in general, a lot of insurances don't do good coverage on the implants anyhow, if they cover any of it. So by definition, even if I accept insurance, I have not a lot to do with insurance people, because not that many insurance have implants coverage. And even the ones that they have some, it's kind of expensive for the patient by the time they pay those premiums. And our prices, we do believe it is very affordable. It is on the lower side for a lot of patients, that they can afford it, that they can pay for it out of pocket. A lot of our patients, even when they come on, we give them our estimates, they compare it to outside, they know that the prices here are not crazy. One of the things that helped me to have good price is I do have my own lab, which means I make my own dentures, so I don't have to add an outside lab fee to my work, unless if I'm doing maybe some partial dentures that they include like cast metal and things like that. We don't make those in-house. But other than that, all the other works happen here in our in-house lab, which help us to cut the overhead for the patient big time. And it helps us also to be more efficient and quick in the services, because most of my services are same day, that's another thing with the insurance cannot happen. You have to send pre-authorization. I used to work in my first clinic where I used to work as an associate dentist. We work with insurance, and you have to do a lot with pre-authorizations, approval. Imagine somebody who's not even a dentist have to look into your x-ray to decide whether you are eligible to get covered for that crown or for that denture or for that service to begin with. So I just don't think that is the right way to do things, because if you're not a dentist, how come you make the decision for the dentist to say, yes, the denture is approved or not approved? Or sometimes, yes, it will get approved no matter what, but it's a process. It takes time. And you have a patient who walks into the clinic, they have pain. The infection is not going to wait for the insurance people to approve things and to take few days or few weeks sometimes. Or in some cases, it was actually taken all the way up to a month to get things approved. And sometimes by the time we get it started or send things on outside lab, the pre-authorization get expired. So guess what? We have to renew it again. So there is a lot of processes are linked to the insurance that I think it delays the work. And I am just not a big believer when you are not the dentist, how you are making the decision to approve something or disapprove something. You're just looking at codes and things and you say, oh, this code is approved or not. You don't see the clinical aspect of it. I think it's just, especially for what I do as far as implants, and they don't cover as much, it was making more sense for me to be a fee-for-service rather than to be an insurance provider.
Well said. Well said. Wow. Wow. You just gave us a whole, like a litany of fire bombs. I mean, just things that people can take and say, oh, yeah, I can use that information. Oh, I'm going to try this. So do you have, I know you said something about taking x-rays, but the 3D scanner, are you working with that at all, or?
Yes. Since I am an implantologist, an implant dentist, I have to have a CT in my office because that is, in my book, is the standard of care. Might not officially out there to be the standard of care but if you are going to technically, let's just keep it simple to people who don't know the clinical aspects of a lot of things here, is if you're working in the garage and you have to dig a screw in a piece of wood, you need to know the thickness of that piece of wood so you can decide the size of the screw that you can dig there. It's as simple as that. So I need the third dimension. X-rays are 2-dimension. There are pictures. They will tell me the height of the bone. That's all what I can get from the X-ray. I can't know the depth of the bone. I can't really accurately determine the quality or the density of that bone. The CT scan is where I read these things. And bone have different dimensions sometimes and thickness in different areas. I have to be able to see the vital structures, the nerves, and that they go there, because trust me, you don't want me to put the implant inside your nerve and make you numb forever, right? So I need to know where things at. And also, before we can decide if someone is a candidate for implants or no, we don't have to cut you open to decide whether you have the bone or no. I would be able to tell you everything and even plan the surgery before the surgery day in the computer, decide the type of, the size of the implants, where the implants are going to go. So all the planning will happen there. It's more safety for the patient, it's more predictability, and it's more accuracy for the all over quality of the work. So
That's awesome. That's great. So, what do you think are some of the misconceptions of dentistry, and some myths that you would just like to make sure?
See, I think the biggest thing is everybody's scared of a dentist, right? We are not scary people. I promise you, we're very nice. We don't bite. We're not going to hurt nobody. We're very nice. Dentists are, I really feel bad for sometimes for myself and a lot of dentists, because everybody is just linking us and connecting us to pain. We're always associated with pain. We do not cause pain. If anything, we relieve your pain. That's just all what I wanted to say. And we're nice people, I promise.
That is too funny. But it's
Yeah, dentists are very nice people. Very, very nice. Not only nice, very nice. Yeah.
Right. So, okay. So then how are you looking at, and thank you for that. How are you looking at any of the new technology coming down the pike? Is there anything that you're looking at and you think you could help you in your business?
Oh, I think technology and AI actually is coming big time to our way. In the receptionist and taking phone calls and answering after hours or even during hours and things like that. Technology also is serving us big time in the digital world, where we're becoming now. I'm now kind of more fully digital in my full arch surgeries, which means we don't have to take any regular impression when the patient is gagging and they don't like that gooey material in their mouth and they're gagging, and And it's more accurate and predictable. As I said, everything is bland in the computer. Once you take the scan and send it to the lab, they design that, and the design is there, the STL file comes, and here we go, we print it out, and it is all being more efficient, time saving, accuracy and quality of work for the patient, and it is amazing. So this is I'm actually few months ago we turned to be fully digital here for the full fixed arch, and for me, coming from fully analog, which where I use my impressions and smart dentistry conversion and things like that, and now becoming fully digital and you know, printing things and printing my temps. If the patient broke the teeth for any reason, you don't have to worry. By the time actually they're driving to my office, the teeth will be ready, so when they come, I'll just take the broken one out and I'll put that one in. So it is making our life and the patient experience pretty much awesome here. So I really love it.
That's great. Congratulations on that. I mean, analog to digital. Oh my God.
Yep.
Yeah, that's the difference. Well, looks like they're going back. Well, that's another idea. But music, I mean, analog, then digital, and then everybody's buying LPs again. I don't know. So I don't know. I don't think that's something that you got to worry about. I think once you guys go from analog and go to digital, I mean, digital is the place to be, particularly for what you all have to offer. So then we've been everywhere. You've really given us a lot of great information. So I'm thinking now we've debunked, we've some of the myths that you may have. We talked about you and starting over from your country and then having to come over here and start all over again. So I'm thinking now, where are we going with respect to the future of your business? And how much longer do you think you're going to be doing this?
So basically, that's a good question, actually, because again, you sometimes start a journey and you see what you see. You can't see the end of where you're going or where you're heading, right? And then the more you keep walking into that track, the more side avenues kind of reveals themselves, right? We're not in the bigger picture, or the plan actually, or the target change the more you walk into it, right? That's just part of the progress, part of the growth itself.
You ought to know.
It's like one of those things that you started, but you never expected that where the journey is going to take you. So when I started this, for me was the dream was, I want to be a dentist in United States of America. That's it. That was the biggest dream. That was like the mountain in front of me. If I just became a dentist here and able to practice, I'm done. Nothing further. After that is being achieved, start working and then learn inside that, oh no, there is some other more specific things that I can do. Implant was not in my book at all when I started this. It wasn't even anything close to it. But I found that through my journey. And then I took that track. And that track took me to the business, because if it wasn't for the implant, I wouldn't be in the business. I wouldn't be into the business of being a practice owner. Getting into that business now took me to the other business of me going, learning about leadership professionally and becoming, more of a professional leader, if you want to say. And that took me a little bit more into it. I started mentoring. That's another aspect that I was not thinking. It was not in the book from day one to become a mentor or to go teach this. It's because I like and I love what I do. And I found out the best way to serve also the patient is not only to treat, because I can only treat so much patients. Like I'm one person, right? But imagine what if I can transfer this skill level to somebody else. And always during that transfer process, you will learn something. You as the mentor transferring knowledge here, you're also receiving a lot of knowledge, believe it or not. This is not a one-way type of process.
Indeed.
So it was so rewarding, actually, for me. I ended up becoming a mentor in the same institute where I personally learned implant, in Implant Pathway in Phoenix, Arizona. That was another milestone for me, because I remember the first day when I went to Pathway as a student. And at that time, I didn't have no mentors myself. I didn't have mentors. I didn't have somebody to look up to. I'm like, I'm just coming here. Let me learn how to do implants, and then I'm going to go out, do them, end of the story. But then when you go into a place and then you find out that you're just surrounded by the best in the field, which is for me at that time, I didn't even know how good these people are till, because I'm not from that field. I'm not from that area. You hear about the names and then, oh, okay, this is doctor this and this. I'm like, okay. And then in a minute, like in my first day right there, I'm like, wow, looks like I am here with the best of the best. Like I just found myself here. And then when you find yourself in that situation, when you are not the best person in the room or in the table, that is actually a big advantage. Because I think one of the things that also pushed me to leave my first job, not only me loving or liking to do more surgeries and more implants, is I found myself to be the best person in that table, because they used to send to me all of the difficult cases, all of the challenges one. And then I was asking myself, then everything difficult comes to me because I am the most senior here, or technically, quote unquote, the best in that setting, in that place. Obviously not the best, of course, like there's nobody who's the best. We're always lacking something. We're always learning something. But then I found myself like in that setting. Okay, at the beginning it feels good. You feel like you're proud of yourself, gives you more confidence, makes you feel better, right? But then after a while it feels like I'm stuck. That is exactly how I felt. I felt stuck because I'm not learning anything new. I don't have nobody around me to mentor me or to teach me or to show me something that I don't know. Not because I'm the best. Yes, I'm the best here, but I know I'm lacking a lot of other skills that I really need to learn. So when I felt like I'm the best person in that room or in that table, I made the decision to leave the table, because then it's no longer benefit for me to stay there. You always want to be in the setting where you will be challenged, where you will be the one with the least type of skills in that table. That is the best table that I want to find a seat in.
Excellent.
That is exactly what happened to me when I went to Pathway. I found myself, I found my people. That is exactly how I felt inside. I found my people because everybody here is way better than me. I'm like at the bottom. Okay, so I get so excited that there is a lot of knowledge. There is a lot of things that I will have to pick up here. And something in my head in that same day, me still being the number 0 here, the one at the very bottom in that room, decided, that idea just kind of shined in my head. What if one day I want to be here with these people, but now shoulder to shoulder, like up to their level? Can I come one day and be a teacher in this place or be a mentor in this place? It just kind of glanced in my head. It sounds as crazy to me in that minute because I'm just here my first day. And this is like you go work somewhere and in your first day, you look at the CEO and you say, I want to be the CEO. Let's just get you the job first before you thinking about anything. So I'm like, let me learn first the basics before I can even think becoming a mentor. And now what type of mentor? The mentor with the best of the mentors. So I'm like, okay, let's leave it that. In that place, I remember, if you see now, I have my surgical hat on. And there is a phrase that they always say, it's have my name here, and then it says, let's drop more screws. That is a phrase that I picked from back in 2017, and I kept it in all of my surgical hats. They also gave us surgical hats as a student coming in, just have the logo on it and all of that. Something in my head told me to keep the hat, because I will wear this hat when I come back here as a mentor. I promise you that was the story in my head. I just kept the hat from 2017. The hat is still available till today in a very good condition because I really babysit it. I take care of it very, very well. And back in 2021, I received, in February, I remember, I received an official letter from Pathway inviting me to come as a mentor. That was a big day. That was a big day. And the first time when I went back, wearing the hat, as I promised myself. And when I was sharing the story, because some of the mentors that they actually taught me were there.
Wow.
So when I put the hat and I said, guys, this is the hat that you gave me in 2017. And I was crying when I was telling the story. And the lesson learned from that story, or the take home message from that story, is you can be whoever you want it to be. You can achieve anything if you really want it enough. You just needed to give it time and commit to it and be dedicated. You will get there sooner or later. You will get there. That in itself, for me, I'm like, is like, I when I was reading the story backwards, I'm like, did I ever know that I will be here? No. But something deep inside me told me I can be here. And I guess I did enough work to bring me here and to put the hat again. And that's why I think even my head was telling me, keep the hat, because you're going to wear it again in a very special occasion. And just sometimes you might not see, because when I made that promise to myself, and I think one of the really powerful promises or commitment people can do in their lives in general is not the commitments and the promises that they give to other person. It's the ones that you make to yourself, because you will hold yourself accountable. And those really, really help you to stay in track, to keep doing the hard work. That doesn't mean I did not go through failures here and there through that journey. Yes, there was a lot of them. But I never gave up. I always said, you know what? Yes, I fall down, get up, shed the dirt, keep going. Clean up and keep going. Clean up and keep going, because I will reach my destination. So that was really one of the things that they really meant a lot to me than anything else, even than me becoming a dentist in this country, believe it or not, because that dream was for me too big at the time when I decided that I wanted to do it. And I even wasn't believing that I would do it, but I said, you know what, let me just do what it takes to get there. And that's all what I needed, I guess, because I actually get to my destination, right? Once you get into that, and I got into that and start doing mentoring in a way changed a lot of things in me, changed a lot of things of even how I practice dentistry and things. The fact that you will be part of somebody's journey and you will add something to somebody's journey is really impactful, is really powerful. Believe it or not only the mentees will be so excited and happy that you're giving them the knowledge, but they actually do not know what they are giving you back. Big things, big rewards, emotional rewards and satisfaction that comes with that, to see people that you teach them something or you share something with them, and then they take, because they will always take it to the next level, because they are younger, they're still passionate, they're still, and they get that knowledge and they start using it. And now one day, you all of a sudden, the people you used to mentor, you see them in places, you see them, they achieve big things, and they change other people's lives. And you feel like, you know what, I have a finger in that too. So I feel proud too, because I didn't do those surgeries, I didn't treat those patients, but in a way, I feel like I have a part in that patient life, because one of my mentees did this, or one of my mentees did that. It is very rewarding. So being a mentor was not part of the plan, but eventually it became a big part of it, because that's literally what I do here, big time, between my clinic and between the mentorship and the teaching and the courses sometimes that we do outside. It just changed the whole thing. It's the business. It started with just being a dentist, and then from a dentist, just having a job. From the job, let's go into the business and actually do now the career shift, because when I was an associate dentist, I was a general dentist. I was doing everything. And then from 2017, I just was only in one track, implant. And that door opened the door for the mentorship, opened the door for me to go learn about leadership, took me to Harvard, becoming a mentor, practice owner. It's just one things bring another things in. And I don't know how when was the last station of this journey would be, but I think the more I keep going into it, more doors are going to open, and I'm someone who's willing to try new things. So I guess that's also add to the excitement, and just exploring different things and different experiences. I always say sky's the limit as long as you want to give it a try, and you can always achieve it. Just start doing it. You don't have to see or to have like a final picture in your head of how things are going to end. The minute you start, that's all what you need. The rest will just come.
What an inspiring story. That was just great. Hey, listen, I don't know. I mean, you gave such so many wonderful pieces towards this end. I wanted to see, was there anything else that you would love to share with any of the new dentists? Because what you gave, really mid of the road type of dentist could use. Someone's just starting the field. Everybody needs inspiration. Everybody doesn't know everything they need to know. They don't even know what they don't know. And you've expressed that. Is there anything that you can think of right now that that you didn't say already?
I think I said a lot already, right?
Yeah, you did. Yeah, you did. It was real full. I
would say, general saying because sometimes I look back and I see if there's anything that maybe I want to change or maybe not. What did I miss along that journey? Again, the journey may sound exciting, especially when you see the results and the outcome. But I always remember, and I will never forget the downside of it, right? The failures that would happen, because this is not, because I don't want people to have the misconception, oh, everything sounds nice and this, and challenges are not nice when they happen at the beginning, when you don't know how they're going to end. They sound nice now, me sitting in the chair telling you, because I'm already crossed to the other side and I already know I went through it and I succeeded. But at the time they're happening, they're scary. And I think that is the biggest thing. Fear is what keeps all of us, or most of us, from preventing us to live in the life, and not to step into things that we think, oh, what if I didn't succeed? What if I failed? What if it's this? What if it's that? Doubting yourself is not a bad thing, but if it will be bad if it will stop you from trying. You will never know till you do it. The only way is to jump. That's the only way for you to know how it's going to end up. And I always say, even if you ended up not succeeding, because success is a matter of time. Everybody will succeed if they try long enough, because everybody's timing is different. Maybe it will take me 10 failures before I succeed in number 11. Maybe it will take somebody else only 2 trials or 3 tries so they will succeed. The longer it takes, sometimes people give up on it. Keep trying and you will get there. That is what I believe in. Along that process, always remember to live the life itself, because that's one of the things I always have to remind myself is I'm someone who takes things very serious, take it dear to my heart. And sometimes I feel like I get stressed too much over things, right? Get burnout. It's normal. We're human beings, right? And especially dealing with a lot of stress and a lot of challenges sometimes, it's burning. Like you feel like you're losing your mind, basically. I go back to the things that I love to do. I love traveling. I do travel, and I take that dear to my heart. Make small little promises to yourself. One of the things I promised myself is a few years ago is I travel always in December because it's Christmas time. And I said, every New Year Eve is going to be in a place in the world that I never been before. Trust me, when I put that target in mind, now my traveling just changed. The taste of the whole traveling changed, because I do have a goal that I'm trying to achieve, that I am every New Year Eve is going to be in a brand new place in this world, period. Doesn't make a difference where that place is. It just have to be in a place that I never been before. So now that is a challenge, or that is a promise, or that is something that I'm giving to myself. That's why I always say, Do not underestimate the promises that you make to yourself. You're not, of course, we have close family, friends, and other people in our life that we have to take care of them and we have to care about them. But another thing I also learned through the journey is you are the most important person in your life. There is no other person most important than you. Even though you are a dad, even though that you're a husband, even though you are a friend, you are a brother, you have obligations towards the people around you, but your biggest obligation is first to yourself. Because if you cannot nourish yourself, if you cannot motivate yourself, if you cannot take care of yourself, you cannot take care of nobody. Nobody. The best thing, I think the best people who are demonstrating this in the plane, when we go, we all travel, but nobody pay attention to this. They tell you when the oxygen pressure falls in the cabin, these oxygen masks are going to come down, right? What did they tell you? Put your mask first, then help your children, then help whoever you got to help, you first. That is not being like selfish or anything. That is just a common sense. And also outside in life, give time to yourself, take breaks and take care of you. One of the things that I really enjoy is, I think, and it helps me a lot, and I think it's important in everybody's life, if that is the time that you spend with you, the time that you spend with yourself. I always, every day, I have my tea time where I sit down and I talk to me about things that I did wrong, about things that I was not supposed to do, about things that I did good, or maybe about me not feeling good, or about me feeling stressed out or frustrated, and me needing to go to how I resolve this. All my big decisions in my life, whether they were business related or personal businesses, or all my travel planning, all of that happen at my tea time when I sit down, and I had to do that every single day. Otherwise, I will feel like I'm missing something big. I think people have to get to be comfortable with having conversations with themselves. I know that might sound crazy, but trust me, it's needed. If you don't know how to talk to you, how to talk to yourself, then I don't think you would know how to talk to people either. It helps in a lot of things. It's a free therapy. Do it. It's every day and it's free. Just find a time where you can sit down and just calm down with you and kind of just talk to you, like, oh, what do I like to do? What do I feel like I'm not doing good, or this or that? Just trying to take it easy. You're not like pushing yourself or hitting yourself hard, but you kind of being honest with yourself and trying to evaluate your life in general, and evaluate, even if you're not in having, sometimes some days you'll feel so drained and tired, you don't have the capacity to kind of evaluate the whole life. Just evaluate that small little day. Say, or ask yourself why you're so exhausted today. Maybe you didn't take care of you enough today. Maybe you were supposed to, to go to the gym, but you didn't go. That's another thing. Gym is one of the things. Going to the gym, I go literally almost every single day except Sundays. And in my days that I feel like exhausted, those are the days that I have to go, because that's where I get my dopamine. Basically, that's how I get happy. So I always say, take care of you. You are the most important person in your life. Of course, family also comes always first. Spend some time with your loved ones, because especially the kids, they grow up so fast, and you don't want to be missing too many things. In general, dentistry is full of stress. This is just a message for all of my colleagues out there. Is this a stressful job? It is. Try to find your ways inside it, because it comes like a lifestyle. Just add it into your life as your life, part of your lifestyle, and learn to delegate. I think this is one of the biggest things we as dentists fail to do. We think we are the only one who can do it better, so I have to do it. No, we are always live with the concept in life that you are very replaceable. We are all very replaceable, whether we like that or no. And we don't have to take it in a negative way, because that is just the cycle of life, right? Tomorrow I'm going to die. Is dentistry field is going to shut down and cry because Dr. Hassan left this earth? No, it will continue, and it's going to evolve more, and it's going to develop more and everything. I'm just a small little piece in that journey. So don't like treat yourself as if you are not replaceable. We are all replaceable. Enjoy life, enjoy dentistry. And I think it's a very rewarding field as well, even though it's full of challenges, especially for somebody like me who had to do it twice or whatever. I think it's worth it. And I will encourage every dentist out there who's internationally trained. They come here the first time. Their licenses are not recognized. I know it's not a nice feeling. I was mad actually at the beginning. I said, no, why they're not recognizing this? I'm not going to do it again. But it's worth it. I would encourage everybody to go through it and do it twice or do it 3 times if you have to. Because it's a lot of fun. Find what you like. Maybe what you like is general dentistry, so do that. Nothing wrong with it. If you like the root canal, which is the one I hate and I don't like, that's okay. Just find your niche, find your passion, and do that. And inside that track, a lot of doors are going to open. And please take the opportunities. Don't never say never. Give it a try. What the worst can happen is not going to work. You can go back to what you were doing anyhow. Or if it didn't happen, it might open another door behind it. So I think this is how life will become more kind of rewarding when we start doing different things and when we start exploring different aspects and different dimension and figuring out different ways of doing things, and always be in the student mode, always be open to learn and learn new things and learn new people as well. Because that is in itself is another level of knowledge, to learn how to, put yourself in somebody else's situation, and now you will look at things differently. With that being said, I mean, it's full of fun. It's a way of living for me. It's dentistry is not only my profession. It's not only the way I make living. It's the way I live life, I think, by now.
That's awesome. That is awesome. Thank you so much for joining us, Dr. Hassan. I would like to, if you're willing to, if someone wanted to contact you, they enjoyed what you had to say and wanted to kind of talk to you a little bit more about whether it's, your business practice or the implantology part, how would they get in contact with you?
So if someone they wanted to be mentored and things like that.
You have a question, they might have a question of some of the things that you had to share, and they wanted to pick your brain for a couple minutes and see how they could take this information and do whatever it is that they want to do with it. I'm speaking in reference to young dentists. They wanted to contact you on any level that had to do with the conversation we had today.
So I think this is and I'm glad you asked this question, because one of the things that lately has been kind of pushing itself into me, and I'm like, it's really becoming something that I need to put it in more of a legit way. I always say I'm accessible in LinkedIn. I'm very active in LinkedIn. They can contact me there, and I'll try my best, to respond back to people. My email is also there. People can email me. Sometimes if I have to jump into a Zoom meeting like this with someone who's trying to learn the process, or sometimes I just send them, if they're new, they're coming from overseas, let's say, and they're asking about the process, I send them the links and the things that they need to do, the steps that they need to do. And we just keep responding and texting and things. And very few times, as I said, I went into Zoom meetings like this.